Hi, and welcome to Integratis Clinic. I'm Dr. Liz Corcoran.
And I'm Carrie Bartlett.
So I am a functional medicine doctor, and Carrie?
I'm a child and adolescent psychotherapist.
We wanted to talk to you guys today a little bit about, because we know there's a bit of an epidemic of using AI for therapy. And you and I think, have some big concerns about that. I obviously must seem very attractive to people. It's free. It's sort of a therapist in your pocket, right?
Yeah.
But there's some big time drawbacks about using ChatGPT and others as your therapist.
I think one of the biggest concerns is around safety. I know that it's been in the media a huge amount at the moment, where there have been some really serious consequences.
Very serious, yeah.
And what we don't want is for young people who are experiencing, or anyone who's experiencing major life events, to think that ChatGPT can give them the same safe and thoughtful containment that a trained clinician can. As I said, it's had huge consequences, and it's a unknown territory that I think even perhaps the creators of these AI platforms don't fully understand yet. So that's the primary concern, I think, when we're thinking about AI, but we do have other concerns as well.
Yeah, and it's really important that you can't really substitute the effect that happens when two people get in a room and talk about how they're feeling and how important it is. There's something that we use in mental health called containment. This is the language that we use. And that means that you're with someone, you know that they're thinking about you, they're holding you in mind. And they're reflecting on the difficulties that you're facing. And the other thing that happens is if they're worried about you, they know that they need to reach out for help, talk to your GP, so things like that. We know that it's obviously, it seems like maybe a quick fix, a quick solution, but you and I both know that when you see a patient, you don't just sit there and say, that's wonderful, great idea, yes. You're not here to help them click on and make another interaction. You're here to actually engage and develop a relationship.
And also to help them to develop skills around thinking. And sometimes in therapy, it's the challenging parts of the work is where we encourage our patients to, think about whether their patterns of behaviour or patterns in their relationships have actually helped them up until now. And through that challenging work, we begin to introduce new ideas, new ways of thinking, and that's really where the fresh start comes from, and that's where the healing process starts, is that difficult work of challenging our thoughts and our patterns that we've had up until now, whereas I think ChatGPT is a little bit of a yes machine. Great idea.
Feels nice sometimes, but it can be a bit dangerous.
Really dangerous, actually, and can sort of collude in unhelpful patterns. Whereas, a thoughtful in-person clinician will gently challenge and guide the patient and work alongside them to create a better sense of integration and sense of self, and really offer that insight into what might be going on for them that has led to where they are at the moment. And I think I think during COVID, talking about online work versus in-person work, we did have to adapt. And certainly some form of therapy, in some cases online therapy can be really helpful, and it can be a really great way of bridging the gap when patients aren't able to come in person, so they can still access quality therapy. But I think what matters is who is on the other side of that screen. And so even if it's not possible to have an in-person appointment, what matters is that it is a qualified clinician who
human.
Exactly. So it's about that dyadic interaction, those two people coming together in a way that's safe.
And I think maybe it can sometimes feel it's quick, it's easy, it's free, but I just really encourage you are worth the time and the money that you would invest in therapy. I often tell people my own personal therapy is the best money I ever spent, and I encourage others to invest in themselves and their healing. So please do reach out to us at Integratis. We're here to answer your questions, and both of us offer free discovery calls.